cardiovascular disease that we think of in the United States is primarily arteriosclerotic, or hardening of the arteries, and that's a buildup of cholesterol, fat, as well as scar tissue in the arteries that occurs over a period of time, usually over decades, related to lifestyle, smoking, high cholesterol, high blood pressure, diabetes. Sometimes genetic disposition results in formation of plaque in the arteries, and it's not a big area. It can be a couple millimeters of plaque that results in narrowing in really important blood vessels. But just like I said, it occurs over a period of time. It actually can be stabilized with medications, stopping smoking, controlling diabetes. In some cases, we've seen a dramatic change when people have had dramatic weight loss. For instance, patients who've had gastric bypass surgery. Those patients do very, very well with resolution of some of that plaque abnormality, but many times that's not enough. When we think about heart disease, it's still the nation's #1 killer. We still have patients drop dead of sudden cardiac death without any symptoms. And those patients probably could have had that heart disease recognized. For instance, if you're a gentleman and you're over 50 and you have a risk factor for heart disease, you're overweight, you smoke, family history of heart disease, in other words, people in the family less than 60 years of age have had a heart attack, or if you have diabetes or other abnormalities metabolically, say a thyroid problem, an endocrine problem, you should see a cardiologist. And the cardiologist will ascertain your risk factors and may perform some testing. Women in heart disease, women have been thought, oh, they don't get heart disease, it's a problem with men. Well, actually, more women die from heart disease than men, and the nation's #1 killer for women is heart disease. So a woman sometimes won't have the usual symptoms that we worry about. The classic symptoms of coronary disease is chest pain that comes on with exertion, goes away at rest, sometimes associated with sweatiness, shortness of breath, and also some nausea. A woman may have a little toothache or jaw ache or a little belly pain, or just not feel well, particularly after exercise. That's when you should see a cardiologist.